All right.
Computer.
Yeah, you need to go. Okay. Are we ready? I can go ahead and open it because it's going to take people a while to.
Yeah, let's go so people can start.
They see can you just ask them quickly all that they see is the slide right now?
M-Chip folks, can you give us a thumbs up if all you can see is the opening slide?
I see slides and our boxes.
Yes. Okay.
Students.
I'm starting to.
Confirming that I can see the opening slide.
Don't you see us?
Good afternoon, everyone, and welcome. I'm Terrence Moore, Chief Executive Officer of the Association of Maternal and Child Health Programs, and I'm genuinely glad you're here. Wherever you are joining us from this afternoon, thank you for giving us this hour. 3 quick pieces of housekeeping before we begin. All lines are muted, and live captioning is on. Throughout today's webinar, we invite you to use the chat to share your reflections with one another. If you have a question at any point, please submit it using the Q&A function rather than the chat. That helps us keep track of your questions. And we're recording today, so the recording and next steps will land in your inbox tomorrow. Now, this is not going to be a webinar where you sit back and listen to me talk for an hour. I need your voice today, quite literally. So let's start there. Take out your phone and scan the QR code on your screen. If you're on a computer, go to menti.com and enter the code at the top of your screen, 84182500. This is how we'll talk with each other for the next hour, and I promise we're going to use it more than once. Okay, I can see folks joining. The numbers are climbing. Take your time. We're not going anywhere without you. So the first question, and it's a simple one, who's in the room? Where do you sit in the MCH ecosystem? Pick the seat that fits best. If you want to rejoin the Menti, once more, you can go to menti.com and use the code 84182500. All right. We have a few more moments for folks to join, and let us know in the chat if you're having any difficulties joining Menti, and we can put the QR code back up. Wow. Okay. So look at this. State agencies, family leaders, community organizations, funders, federal partners, all in the same virtual room. So hold on to that because that mix is not accident. That mix is the point. One more before we start. On a scale of 1 to 10, how confident are you that the MCH field can achieve real alignment in the next 5 years? There's no right answer here. Just answer honestly. Let's see what you said. We have so many responses in Menti that I think we broke it, everybody. So remember your number and write it down because we'll come back here at the end of the hour. So I want to start with a question, and actually 3 of them. What if every mother met a system that was ready for her before the emergency, not after? What if a family never had to carry their own story from one office to the next, hoping someone connects the dots? And what if everyone working for mothers, children, and families pulled in one direction instead of 100? Hold that picture for a second. Now imagine building it together. Here's what I know about this field, and I suspect you know it too. Every single day, people show up for mothers, children, and families. They stay late. They stretch budgets that were already stretched. They answer the phone one more time. They fight for the family sitting across from them. But the ground keeps shifting. Systems are strained. The workforce is tired. And good work, truly good work, gets scattered across programs, sectors, and funding streams that rarely connect to one another. So let me say this plainly. What is missing is not commitment. What is missing is alignment. And before I show you any data, I want you to make a prediction. Of pregnancy-related deaths in the United States, how many are preventable? About 1 in 4, about half, about 2 in 3, or nearly 9 in 10. Lock in your guess if you're able. Thank you for this. So the answer is 87%. Nearly 9 in 10 of these deaths did not have to happen. And here's the part that makes this question of alignment more palpable, more potent. More than half of these deaths occur between 1 week and 1 year after giving birth, and exactly the window when the systems around a mother mostly stop watching. That is not the failure of any one program. That is what fragmentation costs us all. One more thing about this number, because it deserves to be said quite plainly. The burden is not carried equally. CDC's own data shows that Black women and American Indian and Alaska Native women are 2 to 3 times more likely to die of a pregnancy-related cause than white women. And that gap widens with age. Preventable and not evenly carried. Any strategy worthy of the name has to hold both of these facts once. So how did we get here? And where are we headed? Last fall, we started asking these questions internally here at AmChip. Early this year, we brought them to partners, and at my town hall during the AmChip conference in March, hundreds of you weighed in, and you'll see your fingerprints on the next few slides. In June, a public health advisory group came together, and engagement like today runs throughout this year and keeps widening. Then in 2027, the field organizes itself. Community advisory group stands up, and work groups form around the strategy's areas of focus. The places you told us to dig in will for sure dig in. So that at the end of 2028, the strategy, the implementation plan, and the investment plan are ready to go. Which brings us today and you. So what exactly are we building? One effort with 3 connected parts. The strategy is a North Star, a shared vision, and a clear set of priorities that partners across sectors can rally behind. The implementation plan is the how, a roadmap that shows where every organization, system, community, and leader fits, and how their work moves the whole forward. And the investment plan, it's the fuel, a framework for aligning resources behind the change so the vision is funded, not just imagined. They are connected on purpose because a vision without a roadmap and resources is a poster, not a plan. One more prediction. How many children with special healthcare needs receive care that works like a well-funded system? About 1 in 4, about half, about 1 in 3, or about 1 in 7? Lock in your answer. Excellent. 13% is the answer, roughly 1 in 7. And that number has not moved in nearly a decade of surveys. That is not a program failure. That is a system that was never aligned in the first place. And in case you're wondering, even children without special healthcare needs only reach 19%. The system we have is not the system our children deserve. Here's the truth underneath all of this. No single system can fix it, and every system has a role, whether it's clinical and healthcare, public health, community and social support. And I want to name what really matters here: housing, food, transportation, income support, because a prescription can now outrun an empty pantry or an eviction notice. Data must happen, research, profound innovation, as well as policy and funding and advocacy. A baby's health is shaped by the clinic and by the neighborhood. The question is whether these 5 systems pull together or pull apart. When they pull together, families thrive. So this work stands on 5 anchors, and I want to be a little honest about where they came from. I started this list, and at my town hall during the AmChip conference in March, you weighed in on it, you pressure tested it, and you made it stronger. A unified vision, one direction the whole field can see itself in, system alignment, coherence across programs, sectors, and funding, governmental expertise, the backbone of Title V and public health leadership, community voices, families and communities shaping this work, not just receiving it, and measurable outcomes, progress the field can track and be held accountable to. That last one came through loudest in March: accountability. These anchors will keep us honest. Now I want to hand the microphone back to you, and this one matters to me. In one word, how does the system feel to families who navigate it today? Not how we want it to feel, how it actually feels. So type one word, and let's see the word cloud build here. Challenging, broken, overwhelming, frustrated, exhausting, disjointed, chaotic, impossible. Cumbersome, complicated, impersonal, stressful, messy, scary, unfair, underfunded. I'm not going to argue with a single word on the screen, and our job over the next 5 years is to change the words here. Let me be precise about what this is and what it is not, because I know maybe the questions are forming. This is a connecting and aligning framework built by the field for the field, a shared platform for coordination and collective action designed to expand over time. It is not a rebrand of AmChip. It is not a duplication of work already underway. Existing coalitions must continue exactly as they are. It is not finished. And hear me on this last one. It is not owned by AmChip alone and is not finished. Both of those are invitations. Because if this is ultimately about alignment, then it matters who helps shape it. Families and community voices, community-rooted organizations, state and territorial public health leaders, healthcare providers, researchers and academic institutions, philanthropy, federal, state, territorial, and local partners, national organizations, and private sector leaders. Look back at our very first poll. Most of these seats are already in this room right now. Every partner has a part to play, including you. Now, a fair question, why is AmChip convening this? For more than 70 years, we have supported state and territorial maternal and child health programs in every state and jurisdiction. Our membership includes the senior leaders who administer the Title V Maternal and Child Health Services Block Grant, the nation's oldest continuing public health program for women and children. And we move between policy leadership in Washington, D.C. and on-the-ground system strengthening every day. But let me be equally clear about our role. Yes, we're the primary convener, the connector, and a public health voice, but we're not the sole owner. A clear vision shaped by others, carried by a distributed structure of staff, boards, and advisors provides legitimacy and humility, and we intend to hold both. So now for the exercise I've been looking forward to the most, because forced trade-offs tell us more than checklists ever will. You have 100 points here, so spin them. Where does fragmentation cost families the most? Financing and funding streams, data systems, workforce, service delivery and navigation, community voice and leadership, housing, food, and economic support. And I want to say this out loud so you know it's true. This is not decorative. The work groups get these results. Your allocation feeds directly into implementation planning. So let's take a moment to dive in here. See here, so folks are in agreement about many of the vital enabling services like housing, food, and economic support, service delivery and navigation. This is great. So how will this work? 7 commitments guide this process. They're all on your screen and in tomorrow's follow-up, but I'll dwell on just 2 here. Co-creation. This gets shaped through shared input, dialogue, and real influence. If your influence can't change the outcome, it isn't engagement, it's theater, and we are not doing theater. And trust and respect. Relationship first, centering community voices, never extractive, and hold us to all 7. So what comes next? Engagement deepens from here with options for differing capacity levels. In August, listening sessions begin along with systems-focused calls with MCH leaders. In September, strategy labs, community conversations, and our next national webinar. And through the fall, partner convenings, regular updates, and a November webinar. And in 2027, a January webinar, a CEO town hall at our annual conference, and the shift in contribution to action. Every date and every entry point lands in your inbox tomorrow with the sign-up link. There is no single door into this work and no closed list. So before we close out, I want to try something together, and I need everybody for this one. Let's finish the sentence. 5 years from now, a mother in my state will what? Take a moment to imagine what could be different for mothers and families and submit your response in one brief phrase or sentence. You won't see the responses appear right away. We're keeping them hidden so everyone has space to form their own vision. Wow, look at the range of possibilities. We're going to group these somewhat so we can see some of the themes. We'll take a few more seconds here. So here's some of the responses. If we could scroll back up at the top here. So lots of responses around access to care, support systems, empowerment and agency. These themes give us a glimpse of what alignment could make possible. In the future, we have an opportunity to build together. That's right there is the future speaking, and we are capturing every single one of these. So thank you for contributing. So here's my question for you. It's the last big poll and the most important one. Which door will you walk through first? Join a work group, nominate leaders, connect policymakers, engage philanthropy, contribute data or research, or simply stay informed, which is a real door too. And you don't have to wait for tomorrow's email. Please visit nationalmchstrategy.org right now. Push the I'm in icon and tell us which door is yours. It's exciting to see folks starting to already weigh into where they could see themselves in this process. So we started this hour at identifying your baseline number. So recall that number again. And where are you now? That movement happened in some time here. So why don't you make note? What was your starting number? And on a scale of 1 to 10 now, where are you? Awesome. So we're about at a 6. So let's continue to work together over the coming weeks and months and see how far we can get at increasing that number to 10. So we have a few minutes for questions, and we've been collecting them through the Q&A panel, so we can certainly take some of those now. But before we close out, there are a couple things I wanted to let you know. Whatever door you choose, here's what I want to carry out for the next time. I want to thank you for joining us first and foremost. The microsite, as I mentioned, is live right now at nationalmchstrategy.org, so please feel free to join there. And everything you gave us today, the words you typed, the seats you named, the points you spent, all go into this work. So the future of maternal and child health is not someone else's job, it's our job. So let's build onward. So we're going to transition into a few questions. We'll check the chat here and see if there's anything that we can answer today. I want to also share that all this information, as well as the slides, will be available as well. Yes. Paige, you want to read a question?
How does this already align with critical pieces of the system, like the MCH block grant? What can happen to improve alignment?
So as the question has come through the chat, one of the things that we have to pay attention to moving forward is, what does our current system of support offer us? Are there opportunities for us to lean in and have conversations with federal partners and policymakers? But more importantly, the folks that are implementing some of these programs already on the ground, what vision do you have for those programs in the weeks and years to come? And so we hope some of our work can really align with the great thinking that is already out there. That just must come alive and must come to the surface in the process.
How will this effort tap into existing coalitions and work underway?
So the question is, how will this effort tap into existing coalitions and work underway? So as I mentioned earlier, I don't want anyone to think that existing work or coalition efforts are going to be sort of sidelined. We all know that work that is already happening is contributing immensely to the work that is happening both nationally, but also the work that's happening at the state and local level. I think what's missing here is just us simply knowing about all of the amazing things that are happening across state lines in every zip code in every community. And so I hope that we can come together and begin to learn from each other through the innovative practices that are occurring and be able to share out some of the challenges, but also some of the opportunities, some of the ways in which things are already working well. So simply learning from each other, I think, is a huge goal here.
Can you share more about the momentum you are seeing across the nation around this work?
So the question is, can you share more about the momentum you are seeing across the nation around this work? So many of you, hundreds of you, as I'm saying here, are participating today. So I sort of signal that as a strong showing of support for this effort. AmChip rarely convenes webinars where we have quite literally hundreds of people joining us. Many of you have already sent notes and text messages and have shared with members of the AmChip team sort of your excitement and willingness to dive in. I am in no way sort of assuming that this is going to be easy work. I think as we build out a national coalition that is a big tent where everyone is involved and engaged in equal footing, we know that there's going to be a lot of work to do. There'll be challenges along the way. We'll unearth things. I see some things in the chat about ensuring that we're not glossing over some of the super complex things that are the bedrock of our society, things that folks are dealing with in real time in their communities. And so I hope that that can help give humility to the process, but also give strength to the process as well as we move forward. Any other questions, Paige? We have time. There are a lot of questions.
Good morning. I read your article, Every Generation Inherits an Unfinished Promise, last week, and you really inspired me. Can you say more about collective direction and share more thoughts on this?
Thanks for that. The question, someone signaled that they read the article that I published last week. Hopefully, if you haven't already had a chance to take a look, hopefully you will be able to do that. And we'll try to drop the link to that in the chat. In that article, I talk about a variety of things, but one of them is this idea of collective direction. And collective direction, in my mind, is not simply sort of continuing down one road on our own with our own set of activities, our own missions, et cetera. And while those are important, I think collective direction allows us to come together around a vision. And I hope the strategy can be a place where we can identify a whole host of things. While much of the items in a national maternal and child health strategy might reside in departments of health and human services, for example, you all already identified in some of the activities we did today that this is a whole government response, that we have to have all human services engaged from education all the way to employment and all the way to housing. So we can learn from each other. I often think that not one single person or organization is the keeper of all knowledge. And so that collective direction allows us to come together to bring our area of expertise, but align them like an arrow towards the things that we know will make the most sense, the things that we know will matter for moms and babies and families around this country. And so, again, bringing our own unique Michigan, our own unique missions in all of our states, but being able to do that in one shared vision, but also being able to do that and being able to highlight implementation strategies and also the resources that we know we need to be able to do those.
How will AMCHIP engage non-traditional MCH partners in this presentation, discussion, coordination, work groups, including both direct and indirect partners?
So how will AMCHIP engage non-traditional MCH partners in this presentation, discussion, coordination, work groups, including both direct and indirect partners? I'm going to throw that question back at you all. I'm really interested in you all sharing any successful strategies you have had in identifying non-traditional partners, being able to tell us like what your definition of non-traditional partners is, and really helping us identify who those actors or players are and being able to make sure that they are at the table on day one. What we're doing over these coming months is ensuring that folks really understand that this effort exists, that there's no wrong door, that there's many opportunities for them to engage, and we want to know who's missing. We know many of the traditional partners that are available and have been a part of conversations, have long been part of conversations, but we want you all to tell us who's missing and how we might contact them and how we continue to build these concentric circles of individuals that are weighing in on this shared national strategy.
Next question. I am in full support of this vision and unified approach. I wonder how you anticipate moving this forward in an environment when our federal and state partners are not able to discuss, amplify, and articulate a huge part of the issues that undergird the problems that are structural in nature and require us being able to call them out. Those structures and policies further amplify disparities and poor outcomes.
It was a long question, so hopefully you all are able to see it in the closed caption. But the crux of the question is, how do we realize the real battles that we are waging right now regarding what we can and cannot say and do at home, in our states, and in our organizations? I don't think that stops us from being able to have tough discussions. We know what can work. And regardless of what we can and cannot say in this moment, we know that the things that we could say back early in 2024 and beyond, we were talking about those things, but our outcomes remain somewhat the same. We had disparities. So I'm wondering in the upcoming conversations, how are we able to leverage the data and the gaps and what we know needs to happen and what's missing to be able to shape what's moving forward? What sorts of policies need to be in place? Who's not at the table that needs to really spell out what we might be missing? How do we figure out who is not available in terms of financial and human to be able to solve some of these problems. What interdisciplinary options do we have at play that may not currently exist? There's lots of discussion in the chat about non-traditional partners that we don't often engage. How do we get those folks at the table to have them help us shape our thinking, to help us shape an outcome, and ultimately be able to measure all of this work moving forward?
Thank you for all of your work. Can you describe more about what does this coalition look like concretely? Right now, it's still feeling abstract about what involvement would or could look like.
So the crux of the question is, how do we concretize, share out, make more real the coalition? So I'm putting air quotes around coalition. Folks in this question described it as feeling really abstract. The goal of this work right now is to share the ultimate ideas. It's not the end all and be all vision. I'm hoping folks can start to rally behind conceptually the vision of the three products that I mentioned: the national MCH strategy, the implementation plan, and the investment strategy. In terms of the coalition efforts and work, what I'm hoping will happen naturally out of these processes, out of these discussions, is folks being able to tell us, where should we focus our attention first and foremost? You all started to do that today. So I've heard lots of discussions about needing to stand up and convene community-rooted partners that have long done this work for generations. How do we pull in folks that are really interested in, for example, data and metrics? There's some discussion we just spoke about the human needs, whether it's housing or education, issues around the environment, any other structural factors. How do we convene those folks? So I really see this as being, yes, one large tent, but real foci area where folks that have real expertise and interests can weigh into that process in a body. So a body of individuals that are really truly thinking about picking apart these issues and being able to share what needs to happen for us to have different outcomes than the ones that we currently have. All of those work groups would exist ideally in unison and have an opportunity to really inform each other's work over the coming year or so. So yes, we will roll up our sleeves. We will meet virtually, we will meet in person. If there are individuals that feel like they would like to host some of these areas and have a particular breadth of expertise that you could help to lead some of that work, that would be instrumental and amazing. The other place is, while we're sharing this information now, we hope that over time we can convene a group of folks that would act as sort of a steering committee of sorts. So a group of individuals, organizations that can come together to help vet all of the ideas that would come from some of those work groups that I just talked about, so that as we start to fashion the strategy, we're being really thoughtful about what gets involved, what is in alignment, what gets included, etc. Ultimately, however, this strategy has to be endorsed by everyone on this call and everyone that rests outside of this venue. And so we hope that over time, we can start to keep people informed, but also have you all weigh in and quite literally sort of vote on some of the areas of importance in this strategy.
Does AMCHIP see itself as the backbone organization to move this work forward, activating the plan once shaped at all levels?
I see AMCHIP as being one player. I see all of you as being actors and players in this work moving forward. So again, while we're helping to convene some of these preliminary ideas, I hope over time we get to step back a little bit and others will emerge and lead some of these areas moving forward. Ultimately, when we have a national MCH strategy, an implementation plan, and an investment plan, we will need many organizations, many communities, many coalitions to advance some of those efforts. One example is we have several coalitions that exist at the national level that move particular areas of focus right now. We have groups leading federal appropriations efforts, doing education with members of Congress and their staff around key investments as it relates to the maternal and child health ecosystem program funding areas. We have groups and coalitions that are really working on authorizing legislation that exists. We have groups that are thinking through how do we advance policies around sort of midwifery and doula reimbursement, for example. AMCHIP is not an expert in all those areas. So what we would hope is that individuals from around the country that see those real areas of expertise and need uh, entered into a strategy and implementation plan, that they would help to lead some of the implementation work around that as well. So I see us as a player, as part of a larger tent and involved in some of these multi-sectoral efforts.
How do we do this work when we struggle to get buy-in from the people at the top?
How do we do this work when we struggle to get buy-in from people at the top? I think as citizens, our job is to convince folks at all level, not just people at the top, of what is really needed at this time. So I'm hoping that ultimately a foundational effort or strategy begins something that we can all rally behind, that it becomes a megaphone for us to really share out our collective ideas and what needs to happen in our field. I'm hoping it's a way for us to organize our thinking, our advocacy, our educational efforts. But I also want to say this plainly, we all know that this is not going to be an easy effort, and that there will be some folks that we will need to convince in every institution and everywhere across the country. And so I see that as a challenge that is not insurmountable, but simply a challenge that we can all embrace, but together we can work towards figuring out solutions to that.
This is exciting. First, I have a question about who will facilitate the work group meetings. There are so many stakeholders involved with many competing priorities, and I imagine a third-party facilitator would be helpful.
So the question is, who will facilitate the work group meetings? There are so many stakeholders involved with many competing priorities, and I imagine a third-party facilitator would work for these work group meetings. There are many stakeholders involved. So the answer to that is simply yes. Now, I'm really interested in hearing from all of you in terms of your suggestions. Those of you that have great expertise in pulling large coalitions and groups together with lots of competing ideas and thoughts. So again, really looking forward to those suggestions and ideas. And if you have recommendations on any third-party facilitators, folks that have organized small, medium, and large efforts, please let us know. We're all ears and interested in knowing what we don't currently know.
Is there funding associated with this work? In other words, where is the funding coming from to support this very important effort?
So the question is there funding coming from to support this very work effort? Right now, I will share with you very transparently that AMCHIP receives $0 to support this effort. Many of the work that we've been doing around this has been sort of us coming together internally, having conversations with all of you and your members, et cetera. And so that is an area that we want to be thinking about as we build the strategy. We also know that when we get to implementation and convening and all of that, we will want partners to support this effort. So I don't have all the answers to ultimately what funding should and could look like right now, but I hope folks will sort of weigh in and help us think through how this can become sustainable over time. I don't also see this being an effort in which one organization receives a pot of funding to support. I think what we've been hearing loud and clear over the years is, particularly with some of our community-rooted partners, we often engage individuals and we don't compensate them appropriately for their great ideas and thoughts and expertise. And so I put that out there for funders that might be listening on the line, for us to be thinking through collectively what some of the areas of focus could be, what dollar and funding could look like, et cetera, as we sort of advance this work.
So we've had a few questions related to alignment with Title V. So how will you assure the National MCH strategy aligns with the HRSA National Performance and National Outcome Measurement Framework and supports MCH action plans across all states and territories so that this doesn't become just one more plan? There was also a suggestion around, can we unify around the two universal performance measures around postpartum visit and medical home?
So there was a really meaty question that is essentially an alignment question. So how does this effort align with and not become a different plan or another sort of set of things that individuals have to do related to their HRSA funding and national performance measures? I'm not going to pretend to have a great answer for that question right now. I think the question is one that should stand on its own as we start to think through the strategy and what we should be doing, how we can align, et cetera, moving forward. So I think this is a question that would absolutely be something that we'd want to point to in the strategy as we come up with ideas and recommendations on how we implement programs, but how we align what already exists as well.
As a key factor in the social determinants of health, how confident are you that fathers will be strategically engaged in the maternal and infant health planning process?
So, as a dad myself, and I put this in the essay that was published last week, I think it is extraordinarily important that dads and fathers and other caregivers that are considered not front and center in this work are sort of part of the process, part of the brainstorming process, are part of the strategy, are sort of named out explicitly in the implementation plan, et cetera. So individuals that sit in that seat, um, organizations that are sort of proceeding with and advancing fathers and other caregivers, I really sort of implore you all to be a part of that process and bring that particular experience and lens to this work as well.
So I'm kind of combining two questions here. Will this program be culturally grounded for families that don't follow traditional Westerner practices, i.e. Native Hawaiian, Pacific Islander mothers, as well as how will tribal nations be included in this process?
So the answer is yes. We have done some preliminary reach out to organizations that represent some of the communities that were just named in this question. Again, if we are truly going to be a big tent strategy and we want everyone from coast to coast to be involved in this effort, all of those voices have to be involved. They have to be engaged in the co-creation process from day one. And so if you drafted this question, and you're interested in joining on into a work group space, a brainstorming space, we would invite you and hope that you would contribute. I would also ask that as folks sort of are joining on and letting folks know about this, that you share this information out with others that you think would be great partners, great co-creators in this process too.
I work at the local level and there's lots of competition for resources. Given our current political climate, how likely is it that we'll reach a point where funding will be able to adequately support MCH issues?
I'm going to answer this question in a different way. I came from a different discipline prior to maternal and child health, always in the public health space. And one of the things that I talked to my colleagues here at AmChip a lot when I first started almost 5 years ago was I was really shocked at what I considered to be the paltry sum of money that maternal and child health programs receive in the United States. Many other areas receive consistently more resources than the maternal and child health field, well-resourced, and many different areas across care and prevention. So this is not a question about stealing from one entity to help fund our work. I think what we have before us is the opportunity to make the case that a healthy nation where moms and children and families are thriving creates a healthy nation, period, point blank. And so, how do we figure out and make the case that what we put forth in the strategy is not just a good strategy, but it is worth and tied to metrics that will move us well beyond where we currently are? And so, I think we haven't made the case yet. How do we come together to make the case that our programs are worthy of funding at the highest possible levels in every area? So I would like us to imagine that we have a much bigger pie than we are often told we have, and start to think strategically about how we communicate that grand vision about a thriving nation to those that might be skeptics. Any other questions, Paige or David, before we close out?
One that just came through that's about timeline is, what is the timeline to begin the work groups?
So the work group question is one that is not fully fleshed out. We are still gathering information, and now that the sort of grand vision around the work groups has now been sort of shared with all of you, would love to start to concretize. Are there a few areas that we want to dig into right away in terms of work group structure? We are thinking of the next several months until the end of the year, December 31st, as being the idea sharing opportunity, the opportunity for folks to tell us what might be missing as you sort of hear some of us talk about that. For us to start the organization and organizing phase, but ultimately we'll need that time to be able to have us all decide what we want to prioritize in terms of work groups. Having said all of that, I hope that that is work that can begin early at the top first quarter of 2027. I think some of that work, depending on interest and availability of many of you, could start even sooner than that. So I would say, tell us what you want us to prioritize first and foremost, and also tell us if you're interested in being in some of those initial brainstorming spaces as well on these topics.
And
Awesome.
someone did just ask, what do you see as your immediate next steps?
So the immediate next steps are sharing out the information from today's discussion. I also mentioned earlier in the presentation that we want to start pulling together some strategy labs, some brainstorming spaces that are somewhat smaller in nature, that are not multiple hundreds of people. So we'll begin to send information out about that, having folks really signal if you're interested in joining some of those spaces. I keep mentioning the National MCH Strategy.org interface, that website, as an opportunity for folks to start to distill how they would want to work in this process. So I would invite folks to go there or send me a message directly if you're interested in joining a particular area. Once we start to gather that information, we'll share it back out. We'll put out another call for folks to join some of those efforts. But please stay tuned from me and others on our team, opportunities to engage over the next coming months. I mentioned some of those during the presentation. So some things that will happen in late August and September, other smaller webinars as well. And ultimately, as I mentioned, the standing up of some of the work groups in early 2027. Any additional questions for today?
I think others we can.
Okay. So we are collecting all of the questions that are in the chat. We did sort of a snapshot of those questions today. And what we'll do over the coming day or so is we'll collapse all those questions. We will respond to all of your questions. We'll pull together a question and answer document that we'll send out to you that will accompany the slides and also the recording. I know that everybody is very busy trying to do all of the important things that each of you do each and every day in our field. We know that this has been, a difficult period with lots of changing landscape issues going on. But I also think that this is a time for us to reimagine and think about the possibilities, what the future can be versus what is happening in our current moment. I also just want to thank all of you for all of the years of work and sacrifice that you put in. Some of it is seen, some of it, most of it is not seen. And so I just want you to know that you are appreciated, you are loved, you are valued. And I'm excited about working together with each of you as we build this new chapter in our MCH work. So thank you for joining us. And like I always say, onward.